participants to mute themselves and to only unmute either when you're asking the questions or speaking. The governor and Dr. Gottlieb will be answering questions tonight. We also ask that you keep your follow-up questions concise. And with that, we'll start the countdown. TV stations will be getting started in 1 minute. We'll be getting started in 1 minute. Thirty seconds. 30 seconds. Please. We start in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
All right, good afternoon, everybody. Our COVID response daily briefing, more like a monthly briefing, but a lot happens over the course of a couple of weeks. So wanted to update you back with our usual cast, which is Paul Mounds, our Chief of Staff, and Manisha over at Public Health, Josh Jabal over at Chief Operating Officer, and backed by popular demand, Connecticut's very own best-selling author, Scott Gottlieb, who, as you know, is also on the board of Pfizer, former head of the FDA, and has been very helpful advisor for the state of Connecticut. Just give us a little bit of a look about what has happened over the last 3 weeks and a little bit of what we might be able to expect for the next 3 months and beyond. Very quickly on the summary, a couple of things you ought to note. 4,800 positive COVID tests since yesterday. One of the highest ever, but half of where we were, just a couple of weeks ago. So that gives you a good idea of what the trend is on infections. We are probably one of the 5 lowest infection rates in the country at 13.29%. You may go, my God, that's such a high percentage. That gives you a little bit of an indication of what is going on elsewhere around the country. But the good news is the infection rate is way down from 25% just 10 days ago. Hospitalizations, which, as you remember, was a metric we always paid attention to, did not want the bathtub to be overfilled in terms of making sure we can take care of everybody in need. Our hospitalizations down 72, the lowest in a couple of weeks, probably a couple hundred less than where we were then. That's opening up beds. And by the way, we have a lot more nurses returning to work than having to quarantine. So we're also, I think, beginning to balance supply and demand. That's incredibly positive. Not so positive fatalities, 241. That's a very high number. Almost all of them unvaccinated, older, comorbidities, a number which is a lagging indicator. I think that number is going to go down, but all our prayers. Next up, the Omicron impact and last winter's surge. This is sort of interesting in this sense. That vertical axis there on the left is gives you an idea of what was the high water mark. So if in July we were about common, you'll see that light blue line, that's cases. You can see cases were up well over 400%, a lot more COVID-related cases compared to, say, the biggest surge last winter. But you can see that cases and hospitalizations are no longer directly correlated. Vaccinations work. So that yellow line is hospitals, still up a lot from the surge last winter, but down dramatically compared to where cases are in ICU, even more so in green. That case line, that light blue line, maybe reminds you a bit of South Africa, where you saw the Omicron go up and down suddenly. We hope that's going to be the case here. Next up, The risk of hospitalization, just similar to the last chart. The red line, you're not fully vaccinated. The blue line, yes, you are fully vaccinated. Who goes in the hospital? You can see it's 18 times or 7 times more likely if you're unvaccinated. And that's one of the reasons we got to get people vaccinated, keep you out of the hospital, maintain our capacity. And the next chart will show you not hospitalization, but risk of death. And here you can see the red line are folks who are not fully vaccinated. And there you're 18 times more likely to die if you're unvaccinated than if you are vaccinated. Look, nothing is 100%, nothing is foolproof, but it's yet another reminder that the vaccinations work. They keep you out of the ICU and they keep you alive. So all this talk about, hey, I had a buddy, I know he was vaccinated, he still got the infection, is it worth it? I think you're seeing right now, it is worth it. Keeps you out of the ICU and keeps you alive. The next chart is one place where we are continuing to pay special attention, that's nursing homes. As you remember, very early on, we mandated that all the nurses in the nursing home get vaccinated. And 92%, really good. 92% of the residents got vaccinated, and almost that many of the staff. But we also have to get people with the boosters. We've been sending the vaccination vans to the nursing homes. Almost 80% of the residents have gotten boosted. That is making sure that we don't have any big flare-ups there. And we have required the booster for the staff, for the nurses. They're only about 33% have gotten the booster. We've got another 3 weeks. I hope everybody takes advantage of it. We're getting the boosters out to all the nursing homes. And by the way, while we're at it, we're getting all the rapid tests out to all the nursing homes as well. Why are we doing that? What I hope is our last executive order. But we have said it's often people coming in from the outside to see a loved one walking into the nursing home. That's sometimes where you see some spread and infection. So we're going to ask that you either show us that you've been vaccinated, or we'll have a test there for you. Not starting until Saturday. We're getting the tests out, now and tomorrow. But I think that's how we can keep your loved ones safe despite a high community spread around the area. And by the way, you've heard some talk about, we've got a fair number of people in hospital beds. They're on the back side of COVID, but not 100% cured. We have asked nursing homes if they have a wing where people can be there safely and isolate. If they can keep somebody isolated, could you take care of somebody who's in the last stages? They're not going to be intermingling with the rest of the population. This is not what you saw in places like New York 18 months ago, very different. And I think we'll be able to do that and keep people safe. What's up next? Up next is testing. A big rush for the rapid tests, as you remember a couple of weeks ago. Hats off to our team, hats off to Public Health and DAS. We've got over 3.1 million rapid tests distributed, most of them to the schools. We have another 500,000 going out tomorrow. So there's going to be a lot of rapid tests out there. Not everybody has to test every day. You've heard me say that before. But these are available as needed. If you feel symptomatic, if you feel like you might be at risk, get a test, and that will make you clear to be able to go back to work and go back to school. By the way, you probably heard that the federal government is launching their website, covidtest.gov. covidtest.gov. There, I think you're going to be eligible to get up to 4 rapid tests. Go online. I can't promise you how fast they're going to be delivered. There may be some supply chain issues there, but very soon you'll be able to get 4 per person per week. And along the way, tests are available at pharmacies, and the federal government has said those should be paid for by your insurance. So pay for those up to 8 per person per month. And we have over 400 tests all over the state of Connecticut, making sure that testing is widely available to each and every one of you. Finally, 2 last things, and here Scott can be invaluable for us. The therapeutics update. it's still a very small supply that we have available to us. But I'm going to ask Scott to describe a little bit what he sees going forward in terms of in the last stages of Omicron and whatever that next variant might be. What's the mix of testing and therapies and vaccinations so we have a new normal and we can manage through this? And since I can't pronounce any of those names, I'm going to hand that over to Scott in 1 minute. Last thing I did want to say, though, is regards the emergency executive orders and emergency authorization. As you know, I think the legislature in their wisdom said some months ago, let's make February 15th the cutoff date. That's in, a little less than a month. And we take them to heart. I want their input on these last remaining executive orders. We've gone from well over 300, now it's down at 11. And those end on February 15th, unless the legislature acts. You heard some of the executive orders are as regards nursing homes and vaccinations there and being able to visit after a test. Some of them are as regards purchasing, so that if we are in a scramble to get rapid tests like we were a few weeks ago, we can move pretty quickly there. Some of it's as regards workforce. Nurses and teachers, give our public health and education a little discretion so we can get people involved, people back into the hospitals, nurses, teachers as needed on a temporary basis going forward. And finally, masks, which will be probably the broadest discussion. Right now we have masks for kids in school who are less likely to be vaccinated. I think we should continue that a little bit longer, but I say to the legislature, what say you? Because we've got February 15th that we need you to step up and make a call on this so we can keep people safe for a little bit longer. And if February 15th is too fast to be able to make a decision, just renew everything for 30 or 60 days. Give yourselves time to get it right and make sure we can have the flexibility we need to keep people safe. Anyway, there'll be some questions on that, but without any further ado, let me introduce Scott Gottlieb, who's got pretty good insights on what we might expect next.
Thanks a lot, Governor. I'll be brief and just offer some top line thoughts on where we are, where we're heading. As you said, we have a rapidly improving picture around the tri-state region, certainly around the state, but we're not through this by any means quite yet. The pressure on the healthcare system is going to be a lagging issue. The healthcare system is going to continue to accrue cases, even as they have discharges. And even on a daily basis, we're still seeing new cases. We just see a declining level of new cases day over day. When you look at the leading indicators, they're certainly improving very quickly. So, for example, in the Boston region, they look at sewage, wastewater, and you see substantial decline in the amount of infectious material in the sewage wastewater, which is a good leading indicator. When you look at New York City, probably the best leading indicator is people who are showing up in the emergency rooms with COVID-like symptoms, and that's down substantially. Both measures aren't quite down to baseline, but they're down substantially, and they're good leading indicators of where we're heading. But I think as we get into February, we're going to have a better picture of what the overall outlook is here. And there have been people like me who predicted that Delta would be the last major wave of infection, and Omicron came along and surprised us. I think that there is a conventional wisdom right now forming, even among the people who cautioned me that Delta wouldn't be the last major variant and that this virus had the capacity to mutate and surprise us. Now there seems to be more of a consensus building that this Omicron wave may well be the last major wave of infection. This may become the dominant lineage as we go forward, and we're going to be heading into more of an endemic picture as we get later into this year. But that's not a foregone conclusion at this point. But I think more of the consensus is starting to form around that. And so what does that look like? I think as we go forward, we're going to see more of a shift from population-wide measures, policymakers implementing population-wide measures to protect the public as a whole, and more towards trying to empower people to take individual actions to keep themselves safe as this becomes an endemic illness, and as this becomes a more routine part of life, as this becomes just another circulating respiratory pathogen that we need to contend with. And the goal is going to be to try to make sure people have the tools they need to do that they're properly empowered, but also have the tools to try to take steps to keep themselves safe. And then that gets to the therapeutics that you talked about. I think as we go into this year, we're going to see much more widespread availability of therapeutics. Certainly, as we get into the summer and the fall, they should be widely accessible. I think we're going to see much more widespread availability of testing, and hopefully we don't have a situation like we did here where we ran out of tests briefly or didn't have enough, certainly around the Christmas time period. And we're also going to see the vaccines reformulated. Pfizer and Moderna are both working on Omicron specific variant vaccines. Pfizer should have data on that in March. And it could be the case that with a variant specific vaccine, if Omicron does become the dominant lineage and what we have to contend with, if we can fashion a vaccine that's specific to Omicron, it can not only provide the protection from symptomatic and severe disease that we're seeing with the current vaccine against Omicron, but it can restore the ability of the vaccine to also be a much more effective tool at preventing transmission. As we've seen, the current vaccine still does reduce transmission. It reduces your infectivity, it reduces the duration of time that you're infected for, but we do see breakthrough infections with the current vaccine. And there's a belief that if you have a vaccine that's specific to this variant, it could restore its ability to substantially reduce transmission, and then it becomes a even more important public health tool. So I think it's a long way of saying, as we get into this year, hopefully this Omicron variant will continue to subside, that we won't be surprised again. And I think many people believe that hopefully we won't be. Prevalence will decline substantially as we get into the spring and the summer, and hopefully we have that quiescent summer that we hoped last year would be before Delta came along. And as we get into the fall, we'll have a much different toolbox to deal with this that we've long talked about, but we'll finally realize that not just with the vaccines and the diagnostics, but also the orally available drugs like Paxlovid and others that should be coming onto the market. And so I'll pause there. I hope that we have a more optimistic future ahead of us with this. Thanks a lot, Governor.
Hey, Scott, let me just ask you, in terms of that optimistic scenario, is there a hope that right now our infections far outstrip our therapies? So there's going to be a supply-demand disconnect for the next month or two. Is there a sense that at some point, as the infections go down, the therapies go up, it's going to be as routine as Theraflu?
Yeah, look, I think so. I think that as we demand's going to decline substantially as we get into February and certainly March. You're going to see less infections, less demand for these therapeutics, and supply is going to increase substantially. So, just looking at this from the standpoint of Pfizer with Paxlovid, I think the company is going to produce 6 to 7 million doses in the first quarter. Second quarter, I think they've said somewhere on the order of 20 to 25 million doses. And I want to be careful with these figures. They've put these out publicly. I might just be misquoting them. So I encourage everyone to actually look at what they put out publicly. I think in the third and fourth quarter, they said 45 million each quarter. And hopefully, supply will expand as more manufacturing capacity comes online. So you're going to have a situation where you have rapidly increasing supply, rapidly diminishing demand as we hopefully get into the spring and the summer. And so that's going to allow you to actually build up a stockpile. And then at some point, hopefully, FDA will fully approve it. Right now, it's under an emergency use authorization. And that's going to allow the drug to be put into a normal distribution system. So right now, the government is procuring this drug and distributing it to states, as you know. But once you have a fully approved drug that's being distributed through the normal supply chain, it becomes much more routinely accessible, where doctors can just write a prescription, people can go to CVS and pick it up. I think that's all going to happen this year, but it's going to happen against the backdrop, hopefully, of not a lot of demand for it. This will all play out in the spring and the summer. So when we come back in the fall, if infection picks up again, which we all think it will, we think this will settle into more of a seasonal pattern where it's a respiratory pathogen that will circulate in the cold weather. By that point, you'll have a widely accessible drug. You'll have stockpiles of it. You might have other drugs authorized at that point, not on the market. There's other drugs in late stage development, one by Roche. Gilead is reformulating remdesivir as an oral drug. So I think our overall toolbox is going to look much different when demand once again surges for these things, which hopefully won't be until next fall, winter, barring some unexpected new variant coming, which we don't see right now.
Hey, thank you, Scott. And remember, Josh, Manisha, and Paul are here as well to take any of your questions.
Okay, we'll start questions with News 8. News 8. Channel 3 Eyewitness News.
Governor, we've been talking with the legislature about codifying some of your executive orders. Where does the vaccine mandate for state employees fit into those negotiations?
We have not asked for that to be continued. So at this point, the overwhelming majority of our state employees are vaccinated. With that mandate in place, we got a lot of people vaccinated at the last moment that otherwise would be the case. So right now, they and teachers, like everybody else, if you're feeling symptomatic, get a test, but no more mandate.
And as far as testing numbers and state data, obviously the at-home tests don't show up in the positivity rate or any of the data. Is there any consideration of relying more on the wastewater testing that we're doing in Connecticut or some of those metrics that would be a little bit ahead of hospitalizations?
Manisha or Scott, do you want to talk to that?
I can just mention a couple things, which is that the state did have a partnership, and we've seen the wastewater data from New Haven that has continued to be done, but that the state lab in Connecticut also is purchasing equipment so that we can do wastewater testing for a number of pathogens, which are helpful from a perspective of infectious disease surveillance in general. And so in addition to other pathogens, SARS-CoV-2, the agent that causes COVID, will also be able to be part of that surveillance. And we're looking at bringing that online from the state lab in the next several weeks to a couple of months. So that is something that we'll be able to follow in addition to what other partners are doing around us.
Fox 61.
Hi, Governor. I'm hearing reports of children under 5 years old getting COVID, many from daycares. Is there anything being done to protect these kids who are most vulnerable right now?
I'll start. I mean, we only have our executive order that has the mask requirements, doing everything we can to keep kids safe in the daycare and childcare. Anything else to add to that, team?
I'll just add, Governor, that Department of Public Health is working very closely with the Office of Early Childhood, and we are working on developing further guidance to help those in early childhood figure out how to use the tests that we have provided to different facilities around the state. And so we recognize this is a very challenging situation for parents with an age group of children that are not eligible for vaccines, and continue to work with partners in that space, including Commissioner Bai and others in her agency, to make sure that we can help provide a safe environment for children in early childhood settings.
NBC Connecticut. News 12 Connecticut. WTIC 1080.
Hi, Dr. Gottlieb, how expensive is the Pfizer therapeutic pill, and will that change over time as supply goes up?
Yeah, to be honest, I don't know the price offhand. I think I have it in my head, but I don't want to quote it because I might be wrong. They've put that out publicly, so that's been publicly reported. As you know, it's being procured right now by the government, distributed for free. I'm not sure what the situation is going to look like once this is put into a normal supply chain, but we've seen that Tamiflu has been widely accessible and covered by insurance in the past. I wouldn't expect anything to be different here in terms of accessibility to consumers.
Thank you. And Governor, extending emergency powers for 30 or 60 days, is that a long shot at this point? How is that received?
It's totally up to the legislative leadership. Nora Danahy has given them the list of executive orders which we think are necessary to keep people safe for a little bit longer. If the legislature wants to weigh in and change any of those EOs, that's certainly their prerogative, but we need a decision by the 15th.
Connecticut Public Media.
Hi, Governor. In your discussions prior to your most recent executive order for visitor requirements at nursing homes, was it that a lot of nursing homes weren't already doing this, or they felt that they didn't have the authority and resources to actually carry it out?
I think it was a little more the latter, and some confusing guidance from CDC. We wanted to lend clarity to it, especially given the risk we had with nursing homes, a couple of years ago. Wanted to make this a priority, knowing that people coming in from the outside are a great source of risk. So we thought we could deal with that. And we've got the testing available at all the nursing homes to be able to do that starting Saturday.
And just one other quick follow-up question. Do you have an update on efforts to replace Sema-4 for testing capacity in the state when that arrangement ends at the end of the month?
You know that, Josh?
Yeah, we have each of those sites has been paired with a new testing partner who's going to be ready to step in and take that over, and we don't expect any disruptions.
Thank you.
Associated Press.
Thank you, Peter. Hi, Governor, it's Sue Haig. I was wondering if you could please explain a little bit more about your thinking regarding the mandate for state employees. What does that actually mean now? If someone's a new hire, do they need to be vaccinated, or now they don't?
I take that, Josh?
Sure. So first of all, it's important to distinguish the executive order that mandates vaccination for long-term care staff, as well as state hospital employees. So the people who work in the hospitals that the state runs, that mandate will continue. And as the governor mentioned before, actually has been enhanced to include boosters. And that's in parallel with what the Connecticut Hospital Association and their members are doing as well. So we're talking about everything else, the state employees that had the test out option, as well as the educators, K through 12, early childhood. And basically as the governor said, we saw about a 10 to 15 percentage point lift when that mandate was announced to where we are now, but that increase has really flattened off. So at this point, the significant administrative burden on our agencies and on the schools to administer that ongoing weekly testing regimen to chase the people who are chronically late getting their test results in, it's run its course. It's not as sufficient value anymore. So we're going to let that expire as we get to the 15th.
Will the unvaccinated workers still need to wear a mask?
Yeah, and the masking guidance is obviously separate in certain venues. That's mandated by executive order, as we discussed, like in schools and hospital settings. With regards to state office buildings, that is still the case, that all people who are not able to sufficiently distance from themselves need to wear a mask when they're indoors.
And Dr. Gottlieb, I had a question about the therapies. I've heard that some of these therapies are better for some folks than others. Are the ones that you're aware of, are they more broad-based and targeted toward the entire population, or with people with certain comorbidities, like say diabetes or something like that? Did they have to track down a specific drug?
Yeah, I don't think we have good data to look at different outcomes with the drugs in different subpopulations. Some of the drugs have different drug-drug interactions, and so providers might make choices to use one drug or another based on that. They're obviously delivered differently. The antibody drugs are delivered intravenously versus the pills, which can be taken orally. Remdesivir is an intravenous infusion as well. So, providers are making decisions to use these drugs in different settings based on drug-drug interactions and just the ease of availability.
Okay, great. Thank you very much.
Hearst, Connecticut Media.
Either for the governor or Dr. Giussani, will we ever see contact tracing for COVID pick up again in Connecticut?
So I'll just add a few things here. So first of all, we are still doing contact tracing. So the department and local health departments are still involved in contact tracing. Just we're recommending that it does not have to happen in schools. And so particularly through this Omicron wave, because there were so many cases, we started implementing a text option for the first response to when somebody tests positive, to be able to help link people quickly to information that can help them navigate being positive with COVID. In addition, there are calls that are still being made. But as you've seen with the vast number of cases that we've had, there is a different approach that we have to take as you've had so many cases in the last several weeks. So we are still doing some amount of contact tracing, but I think, one thing I want people to remember is that as we move forward in this illness, and it is becoming more of an endemic virus, people can take personal responsibility to let people know if they've been infected and they've been around somebody else who is a friend, a loved one, anybody that they know, and just sort of let people know. I think this is something that people can take responsibility for, regardless of if a contact tracer is tracing down somebody who's had the illness and then exposing others.
And Governor, wanted to ask you about the testing shortage and whether you expect that to subside with the federal government, ramping up distribution of tests directly at people's homes.
I'd like to think that over the last 10 days, we've got, now over 4 million tests that have been distributed. A lot through our schools, a lot through federally qualified health centers. You've got a lot of tests going through the pharmacy. So I'd like to think that supply chain issue is not as big an issue right now. And I think it'll only get better.
And last question for you, Governor. It's an off topic about absentee voting and ballots. For the upcoming special elections, fear of COVID is not a reason that you can obtain an absentee ballot. Wondering whether you're going to propose renewing no excuse absentee voting for the 2022 statewide election.
I think it's the right thing to do. I think we can join the vast majority of other states. No excuses absentee ballot, or at least COVID related, while we still have this high infection rate. But I've talked to the legislative leadership about it. Obviously, what I do only goes till February 15th, but I hope it's something they consider.
So you're going to leave it up then to the Democratic majorities in the General Assembly to propose that or introduce a bill on that?
My recommendation is we should do it.
Thank you.
DT Mayor.
Thank you. Is there a way to get a breakdown of where the test kits have gone? I mean, at one point, DPH had, sent numbers around to what each town was getting. Obviously, the number of kits has increased quite a bit. Just in this press conference, the governor has given two different numbers. I think one was 3 and then 4 million. Do we have any idea what the breakdown is? I know some local departments have been told that the test kits are now mostly going to schools, not to be given out in communities. So do we have some way to figure that out, or some?
Yeah, Dave, we can send you a spreadsheet, but it is 3.1 million have been distributed so far. We probably have another 500,000 going out between tomorrow and Saturday. The two biggest categories by far are K through 12 has gotten about 1.4 million of that 3.1, and then municipalities have received another million. And then we've had, broad-based distribution to early childhood providers, to faith-based organizations, Food Share, other organizations that serve at-risk populations. But as you're alluding to, a number of municipalities have told us they don't want to be in the business of distributing these test kits anymore. So we've basically put it back to them to say, if you would like some, let us know, and we'll work on how we feed that supply. The main channel that is asking for more is our K through 12 schools, and that's where we're particularly focused going forward.
Second question on the employee mandate. DOC employees obviously would not be one of the ones that would have to get vaccinated. Is there a concern that maybe they should be? I know I think the percentage of prison correction officers who've been vaccinated is relatively low, and it's still clearly spreading there. Has there been any thought being given to include them in keeping them in the mandate?
Well, the number of cases among DOC staff is actually coming down. Actually, I spoke with Commissioner Quiros this morning. Definitely trending in the right direction. And we do have over 2/3 of our DOC staff is fully vaccinated at this point. It is the lowest percentage among our agencies, as you point out, Dave, but it is still 2/3. Now, that said, Commissioner is going to be looking at plans going forward to potentially continue testing among that staff, given the particularly high risk profile of those settings, both with staff and offenders as well. So we're formulating plans for how we'll proceed, but we got a couple weeks to lock that in before the 15th.
And then just one final one for Dr. Gottlieb. So let's play your rather optimistic look at the future out. Next fall, next winter, if I need a COVID test or I think I have COVID, do you think I'll be taking a test at home from a home test kit? And then if I test positive, going to CVS and getting one of the therapeutic drugs that'll likely be more on the market at that point? Will the state, next Thanksgiving have long lines of cars waiting to get tested at drive-through sites? Playing it out that you're correct, what do you see it looking like next fall for people?
Well, look, I hope it's a realistic scenario, not an optimistic scenario. Assuming that this virus doesn't do anything to dramatically surprise us, we've never seen a coronavirus undergo what we call energetic shift, where it sort of dramatically changes its features, incorporates new features. The coronavirus is typically, historically, have always undergone energetic drift, which is what this one's done as well. This has sort of mutated along I don't want to say predictable lineage, but every mutation sort of followed previous mutations, and it's kind of mutated along a certain cycle. Even Omicron was something that mutated along a predictable pattern, but it just mutated in a sequestered environment. It was either mutating in a chronically infected individual or in an animal reservoir for more than a year before it re-entered human circulation. So by the time it re-entered human circulation, it was dramatically different. Assuming that this virus doesn't do anything to dramatically surprise us, where it completely changes its features in a way that it would evade our vaccines, our therapeutics, our diagnostic tests. And there's no reason to believe it would do that. That would be sort of unprecedented, that it would acquire such a dramatic change in its features. Where the things we have right now and that we're going to be building up are going to give us a tremendous supply of diagnostic tests, of orally available therapeutics, of monoclonal antibodies that are going to retain their effectiveness, should retain their effectiveness against Omicron, and others are coming onto the market. Lilly has an antibody drug in late stages of development that looks to be very effective against Omicron. And we may have an Omicron-specific vaccine, which is going to restore a lot of the protection that the vaccine provided against prior variants, where it wasn't just effective against preventing symptomatic disease, hospitalization, and death, but also was very effective at preventing transmission. So, come this fall, I think that we should have a situation where there is a large supply of diagnostic tests. These are widely accessible. Yes, you will be able to self-diagnose at home and call your physician or use a telehealth service to get a prescription to go access this at a retail pharmacy. There should be ample supply of these orally available drugs. The antibody drugs should be more accessible. Vir and GSK, which has one of the drugs that's effective against Omicron, the antibodies, is now reformulating that in a subcutaneous formulation. So it could be an injection delivered in a doctor's office. So this sort of vast toolbox that we've long talked about having, that has kind of eluded us because the virus always stayed one step ahead, should be in place. Certain things are going to have to happen. I think we're going to have to, for the diagnostic tests, for example, if you look at them, the expiry date is very short. The FDA just expanded the expiration date on a Binax now to 15 months. So as those get manufactured in a way that they can be stored for a longer period of time, it's going to allow people to buy them and put them in a closet and have them on hand. So different things are going to happen that I think are going to make these tools even more accessible to consumers. But yes, the short answer is, I think come this fall, diagnostic testing should be widely accessible, either at the point of care. We're going to move away from these sort of mass testing sites, these drive-through testing sites. This is going to be pushed into the healthcare system. That's already being done, and into homes through at-home diagnostic tests. And the therapeutics should be widely accessible, where people, will be able to obtain them through a normal sort of retail distribution system.
Thanks. I appreciate that. I don't quite share your optimism, but I hope you're right.
CT News Junkie.
Thanks. Good afternoon, everybody. Governor, in the event that the legislature sort of codifies the 11 or so policies you're looking for, do you think there'll be any need to maintain some sort of flexibility or emergency declaration, or would that be it for you? It would be over then.
No, I think the emergency declaration means we get about $50 million a year from the feds in terms of FEMA reimbursement and SNAP benefits. So I think that's something that's really worthwhile for the legislature to continue a little bit longer.
So would you see that as giving you some emergency powers, continuing past the point when the legislature adopts these 11 policies?
Look, that's up to the legislature. I think it is important, though, that your state government be able to act quickly if the world is not quite as optimistic as Scott and I hope it is. And if there is something that comes along, whether you want that to be the head of DSS or me or public health, we can follow along with the legislators on that. But I think it is important to maintain some flexibility.
Yeah, and Hugh, I'll just add, obviously, the governor is functioning under the construct that the legislature passed last year. And the February 15th date is basically when the executive orders that he currently has in place no longer go forward unless the legislature takes some action. So obviously the executive branch is the most nimble branch of government. It's the branch that really has been serving in various roles to ensure the overall safety of the people of Connecticut. But when the legislature took action last year, it provided as they wanted, an opportunity for them to be truly a part of the process. And now that special act that they have put in place will expire. And so obviously the governor is saying, I'm still going to need some various executive orders in place. But when it comes to what happens after that, that's going to be a discussion that the legislature will be having with themselves.
Right. Now that special act that they passed last year, that expires too, right? I think March 1st.
Correct. You're right. So it's two parts. It's the executive orders on the February 15th, and then the special act on March 1st. So obviously some action would need to take place. And that's why the governor put forth in his conversation with legislative leadership yesterday, that has been reported about the 11 executive orders.
But it's fair to say you guys are looking for some kind of flexibility or nimbleness, let's say, beyond those 11 orders.
I would say the people of Connecticut expects that government has a nimbleness to ensure that they can respond to an emergency that is presented to us.
Okay. I just had a quick question for Josh too. Josh, you had said earlier that the state had paired with some new testing partner to replace SEMA. Who is that, and what can you share about the agreement there?
It's several different ones, and those agreements are being finalized. So we'll share the details on that when that's complete.
Okay. Thanks, everybody.
Hartford Current.
Hi, this is Eliza from the Current. Dr. Ciuciani, over the past few weeks, the proportion of hospitalized patients who are not fully vaccinated has been falling, which seems somewhat counterintuitive. So more people who are fully vaccinated are hospitalized. What do you attribute that to?
So if I'm understanding your question correctly, you're asking about more fully vaccinated people being admitted to the hospital, correct, Eliza?
Yes.
And so I think what we've seen throughout this pandemic, particularly with the advent of boosters and it being opened up eligibility more broadly, is because we specifically see that there is waning immunity over time. We know that vaccinations protect against more severe disease, hospitalizations, death, but there is still waning immunity. And what we are seeing, particularly in our ICUs, is that many of the vaccinated people who are there have immunocompromising conditions, are older. There are more vulnerable people to begin with. And so, unfortunately with this virus, as Dr. Gottlieb mentioned, maybe if there's an Omicron specific vaccine, maybe it'll be able to prevent some of that as well going forward. But right now, what we're seeing is the best way to be able to protect yourself is to get boosted. And we still have made great progress in this, but there still are many people who do need booster shots. And so the reality is that even on regular floors, vaccinated people not in the ICU, some have gotten admitted because maybe they haven't been boosted and they've had some waning immunity, but they are getting better quicker and are able to get discharged faster. So it's a combination of all of the things that I've just talked about.
And we've also seen in late stages of these Omicron waves elsewhere that the infection, the density of the infection starts or is heaviest in younger populations, and then as you get into the later stages of the spread, it gets into older populations, and some of that may be impacting also what you're observing here in this state. But that was certainly true. It was true in South Africa. It was true in the UK, and it's been true in some of the outbreak states here in the US as well. Where the early stages of the epidemics waves were in younger populations. And then as you got into the later stages, people who did a good job of protecting themselves from infection eventually got into those communities as well.
Thank you so much. Dr. Ciuciani, just one more question. I'm curious to hear your thoughts on this conversation of a declining surge and maybe some sense of a return to normalcy. What would your message be to Connecticut residents right now as they think about COVID safety measures going forward and perhaps this new stage of the pandemic?
I do think that we have seen a lot of transmission of the virus. We've seen this up and down that we see happening, although there's still a lot of burden in the hospitals, and that'll take longer to come down. But with that, I do think that we are approaching more of an endemic phase of this virus in our community. I would like to share the same optimism that Dr. Gottlieb has, but I also do have caution about this virus surprising us throughout this pandemic at various times. But I think what people have to remember about that is regardless, we are learning to live with COVID. We have so many tools with us now. And I do suspect that we will see surges every winter time, and that we have to be prepared for that we are going to have to prepare to know that we are going to see surges when we see respiratory virus surges usually. I'm hopeful that this summer is going to look better, that we will get a little bit of a reprieve. That is my hope. Last summer, the Delta variant came and sort of interrupted that hope. I had hoped that we wouldn't see a surge before the fall again, just like I'm hoping that we see now. But I do share the feeling that we're moving to an endemic phase of this virus. We are going to have to get used to learning to live with it. People are going to have personal responsibility, and that includes caring for ourselves, our family, our neighbors, and those in our community and those that are most vulnerable, because there's certain things that those people cannot do beyond what they're already doing to protect themselves. So I think we are learning to live with this virus. We will be able to do that, but I do anticipate that we are going to see surges every year for a little bit until more and more of our population at large has immunity within it. And this concept of herd immunity that people have heard so much about is not a finish line. It is a continuous milestone that we are getting closer and closer to. And really, when we are past it is when we know we have reached there. It's not going to be some artificial number that we have faced in terms of the number of people infected or vaccinated.
I mean, just to put a final point on that, just pick up, I agree with everything you said. This is going to be a persistent risk. I mean, this is going to be a respiratory pathogens that circulates in the wintertime. And, we could get a lot of infection as a seasonal pathogen as well. And I think one of the big risks for the future, I won't say the biggest risk, but one of the big risks for the future is that we have a normalized flu season. I mean, we've seen 2 years now, probably this year is another year where flu is going to be down certainly from baseline. Last year, there was a very small flu season. On the back end of this, we haven't put a lot of flu immunity in the population for a number of years. We're going to have a very big flu season, and you superimpose some level of COVID spread, and maybe a substantial level of COVID spread in the wintertime on top of a bad flu season, and that can be an extreme burden on the healthcare system. So this is going to be a challenge going forward from a public health standpoint. We're going to have to be much more vigilant about the spread of respiratory pathogens in the wintertime than we've been in the past.
Thank you both.
Waterbury Republican American.
Thank you. Dr. Giuttani, there has been a large increase in the number of breakthrough cases since the first Omicron case was confirmed here in Connecticut. We went from about 26,000 to about 11,000 breakthrough cases in that time. The number of fatalities has slightly more than doubled. What's the cause?
So I think it's some of the things we've already talked about, Paul. First of all, when we look at fatalities in the number that you saw that the governor posted, about 241, only 8 of those people had been boosted in that group. And we know that vaccine immunity that we develop really is best supported by getting that booster shot as well. I think that what we've seen is that our most vulnerable populations are at risk, and particularly older adults, once the virus reaches them. And I do think what Dr. Gottlieb said is very accurate, that the people who are moving around, traveling, and out socializing may have been the initial groups of people who got Omicron, but that eventually it does make it back into households, into those that are trying to be most protective. So I do think this is where personal responsibility does factor into the equation, because I think we're seeing the consequence of the virus making its way through our community in various different populations. So I think the risk factors remain the same. older adults, those who are immunocompromised, those who are vulnerable, those who are not boosted, those who are not vaccinated, are always going to be those that are most at risk. But to your question specifically about breakthrough, I think we still have work to do and room to grow in terms of the number of people that are boosted in our state. We've done quite well. We've done better in the oldest age groups, but there is still more work to do in terms of getting people that third shot.
So is it more a consequence of just the passage of time that people haven't gotten a booster, so their immunity is not as high as it was, or is the fast spreading Omicron a factor in this? Is it a combination?
Yes, I think it's a combination, Paul. I think we know about the waning immunity. We knew that going into the winter season. That's why we were pushing boosters so much in the fall, because we knew that as it got colder, darker, all the things we know when respiratory viruses circulate, that we would be facing that. But then Omicron came, highly infectious, highly virulent strain, very easy to catch. And so it was a combination of both of those that I think really resulted in what we've seen happen over these last several weeks.
Yeah, and just one final comment. Remember, Omicron spreading in part it appears to be a more innately contagious variant than Delta was, which is hard to imagine because Delta was such a contagious variant. But in part, it's spreading so quickly through the population because it evades the immunity that we've acquired. It's reinfecting a lot of people who were previously infected with Delta, and it's infecting a lot of people who've been previously vaccinated. We're seeing a lot of breakthrough infections. That is why this has become a worldwide epidemic, is because it has immune evasion. The vaccine, we're now sort of 4 variants and maybe 5 variants removed from the variant on which this vaccine was based, the old Wuhan strain. And so the fact that the vaccine is still providing the level of protection that it is against such a mutated virus is reassuring and I think exceptional, but it is not protecting this. It is not providing the same level of protection against infection that it did against prior variants, which is one of the reasons why people are looking at trying to formulate a vaccine that hopefully can restore some of that protection against any infection and not just more symptomatic and severe infection.
Okay. And what percentage, if anybody knows, of the nursing home employees, not just nurses, I mean, all employees are vaccinated? We got some figures and boosted. We got some figures earlier on the nursing home residents, but what about the staff?
Staff is about a third boosted at this point.
Okay. I got a couple of questions for the governor. Where do things stand in terms of your discussions with the legislative leadership? You presented your recommendations to them yesterday. So where do you guys go from here?
We sat down yesterday virtually, went over the importance of the 11 executive orders, most of which we've discussed today, saying it's really important from a public health point of view that they be continued or adjusted as you see fit, but they can't just end on February 15th. Anything else on that, Paul?
Nope, good. Nope, that's just about it, Governor. And I think one of the things is the legislative leaders obviously wanting to talk to their various caucuses and report back to the governor based upon those discussions. But as the governor said, February 15th is a very critical date. And there's only so much that the executive branch can do based upon the legislative actions that the legislature took to create the February 15th and the March 1st end of that special act that they did last year.
Yeah, I understand that, but did you guys say, hey, we'll get together again next week? We'll get together on such and such a date. Obviously February 9th and February 15th are fast approaching. So I would imagine that it might be perhaps advisable and helpful for all involved if you guys got together again and let everybody know where everybody stands, right?
Yeah, if you want to, here's the great thing about the governor's office. You see the governor, he's in his office. You see me, I'm in my office. We're always here. So we always are willing to talk to them, but the governor was very clear on where things stand right now. And obviously they wanted to take it back and discuss with their various caucuses. And we respect that. We respect their deliberative process. But we also know that February 15th and then eventually the 16th at 12:01, we need to know where we stand to be able to truly deal with this emergency that we're still in.
So no follow-up meeting date has been set. That's basically what I've been asking.
No,
So
no, the staffs are meeting. Obviously, as the governor said, our general counsel, Nora Danahy, has been leading those discussions. But that was the takeaway from that meeting. But they also said they wanted to go back to their various caucuses. So we respect that process.
All right, and Governor, the Senate Republicans today unveiled some proposals to, I guess, create some public reporting requirements, quarterly reports on how the state and local governments are spending coronavirus relief and infrastructure funding. Don't know if you were briefed or aware of those proposals, and I was just wondering if you had any.
Yeah, Paul, a little bit. Look, I'm 100% there. We've got to earn the trust of the taxpayers every day. That requires transparency. As you know, Melissa brought independent auditors to take a look at what's going on at the municipal level. We saw what happened in West Haven, make sure that doesn't happen. As you know, we have the auditors of public account here in state. They report to the legislature, appointed by them, 100 people strong. So they'll be going over every dollar expended here at the state level as well. And if we see anything untoward, you'll know about it.
Yeah, and I'll also add to that, Paul. As you saw, Melissa McCall, the Department of OPM, they've presented their report to the comptroller. Every month, when you go to that report, you see every expenditure of federal dollars that has been done by this administration. If you go to the OPM website, you will see every dollar that has been expended by this administration or federal dollars. And I also add, when it comes to ARPA dollars, we know what every single ARPA dollar is being spent. Why? Because it's prescribed just like the budget that the legislature passed. So I understand what Senator Kelly and his caucus are saying, but we got to make sure that we're dealing in the world of truth. And the truth is, this is a transparent administration, has always been, and will continue to do so, no matter what dollar is coming through to the state coffers.
Well, now you confused me, because the governor seemed to say at the start that, hey, that might be a good idea. And now you're saying, well, we already do this. We do it.
They were going into other things, Paul. I wanted to focus on that federal dollar part. But obviously, we have the transportation dollars that's coming in. That's coming through the usual formula process. I think I'm reiterating what the governor said. Yeah.
Okay. All right. Thanks very much.
The day of New London.
How's that, Pete?
That's it.
Thank you. I heard a few things. I mean, a year and a half ago, we were always talking about bending the curve, if you remember, when it came to hospitalizations and infections. I think what you've seen with Omicron is it's more of a V shape. It went up dramatically. The good news is the infection rate's going down, hospitalization, fatalities following that. That's very good news. That gives us maybe a little bit of time, like Scott Gottlieb was saying, where the infections go down, the therapies go up, so we'll reach a balance that helps us manage through this thing. And but as Manisha said, you never know what could happen next. There are a lot of unexpecteds. That's why the state needs a little bit of flexibility going forward. But that said, thank you guys for being here. Scott, I'm gonna go home and curl up in front of uncontrolled spread. Take care, everybody.
Thanks a lot.
That's weird. I don't understand. Try it again.